All right, so let's talk a little about the effects of ultrasound. Two main effects, and those are thermal and mechanical effects. So, thermal effects, um, what we're seeing is just from the vibration of the molecules that we're getting friction between those molecules, and that increases the heat production. So, the heating effect from ultrasound is going to be just like the heat that we can produce from any other type of heating modalities, from hot packs to diathermy. The difference here is that we're able to get a pretty good depth of penetration. Hot packs are very, very superficial. Usually, you can only measure those temperature increases in the just barely past the skin. But with our ultrasound, we can get down to a couple inches. So we can get a couple inches penetration if we're using 1 megahertz. So the effects then are similar to anything where we can increase the heat. We're increasing metabolic rate. We can possibly reduce pain, alter nerve conduction velocity. Because we're increasing the heat, we're going to increase circulation as things vasodilate and brings more blood flow to the area to try and cool things off. And we can possibly increase soft tissue extensibility by affecting the collagen. And we affect the collagen by aiming this at something that has that high absorption coefficient. Okay, so we got to kind of answer the question about what about muscle. Okay, it does not work very well with muscle. So next time you're seeing someone in the clinic and they're busy ironing, a low back or a whole quad or something, try and put a stop to that. It's mainly just wasting everyone's time, including the patients. So, tissue effects, way back as early as 1967, Archives of Physical Medicine, these guys, Lehman, looked at what it takes to make a difference. All right, so, what kind of temperature increases do we have to be able to see in order to make a difference? Okay, so at 1 degree C, we see some increases in metabolic rate. And when we get to 2 to 3 degrees C, we see some reduction in muscle spasm and pain and an increase in blood flow. So there we're starting to see some effects of vasodilation. But the big thing is we've got to be greater than 4 degrees C in order to increase our collagen extensibility and inhibit some sympathetic activity. So that 4 degrees C is going to be an important number to be able to get to. Okay, so lots of words here. So factors that affect the heat delivered. Absorption coefficient. Okay, so depending on what we're aiming this at and the absorption coefficient, that's going to affect it. The sound head speed. Now, on one hand, sound head speed, from a clinical standpoint, you're going to hear people saying that you've got to move it extremely slow. The textbook answer is you should be moving it at about 4 centimeters per second. Okay, a study that came out in 2006 in JOSPT, though, says that speed doesn't seem to matter. Okay, so this is a little bit of a confounding issue when the literature is telling us one thing, but clinical practice is saying another. So, reflecting back to the textbook answer, it should be, you should be moving it fairly slowly, like about that 4 centimeters per second. But the bottom line is it does not seem to matter that much if you're doing a small treatment for a long enough period of time. Okay, so the rate of heating is proportional to the absorption coefficient and the frequency that you have. Okay, we already talked a little bit about frequency. That frequency, the higher the frequency, is going to be for a shallower depth of penetration, and it increases temperature 3 to 4 times more than 1 megahertz. So this means we're going to be turning that 3 megahertz way down in comparison to our 1 megahertz treatment. All right, it gives us less depth of penetration, but much more rigorous heating. And just remember that turning the intensity up does not change our depth of penetration at all. Okay? It's just going to depend on what our rate of heating is going to be. Okay, so but not increase the depth. So then duration and intensity, that if we increase our intensity, we're going to be increasing our temperature. And if we increase the duration, we're also going to increase the temperature. Now, unfortunately, this doesn't work like our iontophoresis, whereas that if we decrease our intensity, it automatically increases our duration. That would be a very nice thing to have on our units, but we don't. So when you have that standard 10-minute treatment, and you're doing it at 1.5 watts per square centimeter, which is very commonly done in the clinic, and the patient's complaining of pain or too much heating, And then you go and turn down the intensity. What you should be automatically thinking in your head is, I need to increase my time a little bit. Okay, this is very rarely done, but you should be increasing the time. And most of our ultrasound treatments probably should be longer than what we're doing. All right, so other factors that affect the heat delivered, that would be local cooling effects. Again, once we get up above 2 or 3 degrees C change, we're going to start to increase some vasodilation. And so your body's going to be trying to cool that area. And then finally, that final intensity is set by our patient comfort level. And so if they're complaining of too much heating and you turn it down, that's going to make a change in how much heat gets delivered as well. All right, so this article is listed on Blackboard, and this one's quite a nice article to look at, because what he did was inserted a temperature probe down into the calf of a bunch of college students like yourselves, and then just measured the temperature increase. Now, on one hand, we're not going to be doing, or hopefully not going to be, ultrasounding a whole lot of muscle, but it does give us some very good indication of what kind of temperature increases we can expect given time. So he measured temperature at the depths that are listed here for 2 different frequencies, and what he found was that we needed much longer times to achieve vigorous muscle heating with increased intensity. So let's look at the chart. Here's his results here. Okay, so a lot of information on this chart, and the stars, the single star just means that the temperature increased by less than a half a degree, and so there's nothing listed there. And the 2 stars mean they stopped because the patient said this is too uncomfortable. All right, so looking at the 1 megahertz chart on the top part of the chart, you can see in order to get that 4 degree C change, that they had to go out to at least 10 minutes. That's if everything was ideal, right? And so with the intensity turned up to 2 watts per square centimeter. Now, as we see when we go to lab, you're not going to be able to turn up too many people to 2 watts per square centimeter and hold that there for 10 minutes without burning them. So most likely you're going to be down in the 1.5 range, maybe a little bit higher than that. But you can see at 10 minutes we're only up to 3.5. So that means that we really need to be increasing this treatment time out, another 2 to 3 minutes in order to get up to that 4 degree C range. Now, if we're looking a little shallower, let's look down at the bottom part of the table here at 3 megahertz. You can see at 1.5 and 2 watts per square centimeter that we can't get past, really much past the 5-minute mark. Okay, at 5 minutes, person is terminating this due to being burned. Okay, so again, you've got to turn down the 3 megahertz. You're usually going to be down in about the 0.8 or so watts per square centimeter range. So if we look at the 1 watt per square centimeter range, you can see we get a nice 5 degree change at 7.5 minutes. So it just shows you it's much more rigorous heating. The disadvantage here is that this is pretty shallow, so whatever you're aiming at has to be within an inch of the surface in order to take advantage of this nice heating effect. All right, so let's look at connective tissue effects then. So this is really where our bang for our buck is when we start to look at ultrasound. As we looked at the absorption coefficients, this is the stuff that we're going to be able to heat up. So larger temperature increase is possible in connective tissue over just about any other thing that we're going to be putting this ultrasound through. And so there are a lot of different studies out there. Chan 1998, we'll talk about this one. Another name to put into PubMed is Draper. I think I have some of his studies coming up in some other slides, looking at heating. Where they took thermistors or thermometers basically in a needle, embedded it into various things, that they're going to be heating up. So they did a lot of things through patellar tendon, through the gastroc, through the Achilles tendon, things like that, and just to see what kind of temperature increases we can get. So Chan 1998 here, he used 3 megahertz at 1 watt. And keep in mind that at 1 watt at 3 megahertz, that's pretty aggressive. And so you're going to find that that's pretty hot when we start working with this in laboratory. But he did this for 4 minutes over the patellar tendon at twice the size of the sound head, or the ERA. Just interpret that ERA as really the size of the sound head for practical purposes. But what he found is that they were able to increase 8 degrees C. Remember, we're looking for 3 to 4 degrees in order to make changes in the collagen. And so it took 20 minutes to go back to a baseline. But the important question is here is, how long did you maintain that 3 to 4 degrees? And so what they found was that they had about a 4-minute window there that they were, that they maintained higher than that 3 to 4 degree change. And that's really the clinical implication is, okay, when I heat something, how long does that last? So I know how long I can either stretch or work with that particular tissue. So at the last bullet there just talks about, okay, they increased their area to twice that size. They had less temperature increase, took a shorter amount of time to return, so they had a narrower window. Okay, so really the take home is you need to know how hot you get something, and then what your window is for working with that tissue as you go along. All right, so those were all thermal effects. So now we're going to focus a little bit on non-thermal effects, and in order to get to promote the non-thermal effects, we're going to use ultrasound in the pulsed mode. Okay, so whenever we have ultrasound on, we're getting these effects. Okay, we're getting mechanical effects, but we're getting it combined with heat. So the idea here, though, is that we turn this to a pulsed mode or a duty cycle such that we cut down in the amount of heating that's happening, and so we get a non-thermal response only. All right, so and the one that's been studied most often to do this is that 20% duty cycle. And some machines, that's all you have. You either get in pulse mode, it goes directly to 20. All of our machines, you're able to set that though. All right, so those mechanical or non-thermal effects are cavitation, microstreaming, and acoustic streaming. And basically, cavitation is just formation, growth, and pulsation of the bubbles that are caused by the ultrasound waves or those sound waves. And with our machines, we only have stable cavitation. We have to go up to much higher levels than what we're able to do in the clinic in order to have unstable cavitation. But because those bubbles are pulsating and growing smaller and bigger, we get things moving around, and that's what microstreaming and acoustic streaming are. So acoustic streaming is just a larger version of microstreaming, and so we get these small currents and things starting to move around. So okay, so what good is that? And so what seems to be happening here is that it's affecting cellular level processes that are key to healing. And so we're promoting normal cell function, and as listed here, there's a number of things here, but increased mast cell degranulation promotes macrophage responsiveness, increased rate of protein synthesis. So all kind of good things when we're talking about the healing process. And a lot of other studies, looking at various things. And if you really want some in-depth information on this, go talk to Dr. Turner, as this is what his PhD dissertation was about. All right, so he can talk to you in great detail about that. But basically, we're affecting those cellular level processes that are key to healing. So keep that in mind when you're looking at applying this in the non-thermal mode. All right, in the next part of this lecture, we're going to go into clinical applications. All right, I'll see you then.